Hi, my name is Dr. Marcus Collier. I am a vitreoretinal surgeon in the United States Army. I'm going to speak today on prevention of ocular injuries in the United States military over the past 75 to 100 years. It's interesting to note that the requirements and necessity for eye protection don't necessarily fall within the medical domain. It falls primarily within the commanders and supervisors for our military service members and the service members themselves. Every service member is expected to wear their own eye protection, and that protection must have polycarbonate characteristics and be approved on something called the APEL, or Approved Product Eyewear List. This product list has been developed over the course of 25 years following extensive studying by the U.S. military, and it protects soldiers from ballistic munitions as well as sand, dirt, and other environmental conditions. In its history and infancy, the desire and necessity to protect against eye injury began out of World War II primarily. And even prior to that, in World War I, there were some early efforts to develop eye protection. But in World War II and thereafter, there was really an interest and focus on developing occupational visual standards. And following that, the U.S. military developed standard classifications for occupational hazards. This then evolved following the Occupational Safety and Health Act in the early 1970s into formalized requirements for employers to protect against injuries in their employees. The military, however, has its own rules and policies in place. DAPAM 4506 is the governing document for the Army Public Health Command, and dictates the processes, policies, procedures in order to protect all service members from eye injuries. This policy was initiated in the 1990s following Desert Storm and Desert Shield, where initial efforts at military combat eye protection were employed. There was some lack of interest by soldiers in wearing eye protection due to the bulky nature of the eyewear and the lack of a cool factor in wearing large goggles. Early on in the Operation Iraqi and Enduring Freedom Wars, there was a very famous photo taken of a soldier wearing sunglasses that had polycarbonate eye protection. And when the soldier sustained an injury to his face, peppering type injury, there was a lot of blood and various trauma. And there was a before and after photo where the eyes were completely protected while the rest of the face was affected. Had he not been wearing his eye protection, he would have certainly lost vision. This picture was publicized throughout the United States military and became a very well-known photo within the military. Following this, the military's approved products list for eyewear expanded to include many of the more common commercial or premium type sunglasses that had polycarbonate eye protection after they had been validated and identified as safe. This expansion of the APEL list really improved compliance within the military with the use of eye protection. There were also educational marketing campaigns that were employed in order to improve service members' knowledge of what was approved, as well as improved logistical chains in order to get access of these products to service members. Of interest, the military doesn't limit eye protection to just the military service members. The military working dogs also wear eye protection called doggles in order to prevent and protect their eyes, given that they are in similarly high-risk environments. Lastly, I wanted to comment about the development of eye protection policy within the military. This is housed within the Tri-Service Vision Conservation Program, which is under the Army Public Health Command. It's here that the Army, Navy, and Air Force have personnel, generally military optometrists, reviewing information, data, educational policies, feedback from the military force in order to improve the policies and educational content to protect and prevent against eye injuries, both in the stateside training environment as well as in deployed environment. All of these factors together have improved the compliance of the United States military with the use of eye protection over the last 100 years. I really appreciate your attention and listening to my talk today. Thanks.